sedentary lifestyle. Sedentary lifestyle by means long sitting hours on the chair, or using a bike for too long on the bumpy roads, or any kind of work which is affecting, which is giving jerks.
So doctor, now as you said, avoid the bumpy roads, these things we will keep a note of it. Apart from that, there are people who tend to have they have a hump on their back near the shoulder or near the neck especially. But I have this problem. What causes and leads to this problem?
So one of the causes is this forward neck bending for the long hours, like we are doing it. We are using big pillows. We are continuously looking at our mobile throughout the day. I've seen people sitting in metro, people watching movies, people there all the time their neck is in the forward bending position. That's not a good position. That's not an anatomical position for our body. So that's why these bumps are there on the neck, and that can cause severe cervical issues for the patients. That's why patients should do stretching, they should do hot fermentation, they should do isometric neck exercises. These kind of patients can get benefited with these problems. And people who are in severe pain, patients who are coming to my OPD, other than these modifications, I definitely prescribe them some drugs to relieve their pain. So obviously a prescription is required to write those drugs. Other than that, these are the lifestyle modification we can do to prevent these issues. Once this issue is already developed, I will definitely give multimodal treatment by prescribing medication, exercise, and avoiding these precursors or triggers for the back pain.
When you talk about sitting, as you already mentioned, what is the right posture that should be maintained while sitting or even while sleeping?
Okay, so we talk about sitting. So when we are sitting, we should be upright. We should not.
In the right position?
Yeah, now you are sitting in the right position. Even now I am sitting. So we should keep it up, our back upright, straight. And if we are working on a desk, our desk should be at least at a height that we can comfortably do our work with the upright position. We should not bend. Even the children in school and the people, office going people, they are sitting on their tables and they are doing on their laptops for long hours work, and they are bending forward. So all this can create problem at the neck and at the lower back. Second, about sleeping, if we talk about, the most important thing is people with cervical issue should not use big pillows for their neck. So if we are lying down on our back, we should not use a pillow, and if we are lying on the sides, we should use a thin pillow. That's more than enough. And if we talk about the mattress also, it should not be too much soft, because too soft a mattress can cause spine issues. So people can use ortho mattresses and all, or the simple cotton mattress is more than enough. So these are the few modifications we can do our in lifestyle to reduce our back and cervical issues.
Doctor, are there any tests that we should take in 6 months or in a year to know how healthy our bones are?
If somebody is feeling spine issues, somebody is suffering from spine issues regularly, they should get at least their vitamin D, their vitamin B12 and calcium level checked, and that should be prescribed by a spine specialist, and then according to that the spine specialist can prescribe them medication if that is falling in under the lower margin.
Thank you so much, doctor, for taking time out and joining us. I'm sure people who are listening to us, they will be aware of at least the right posture that they can maintain while sitting, while sleeping, and the modifications that will keep them healthy and happy. Thank you so much.
Welcome.
Healthy India की trusted lab.